This is Gateway 101. Don't forget that we talked about what is arthritis and what can help manage it. Part 2. This will be the part 2 because we talked about this yesterday, this afternoon. So this will be the part 2, okay? And remember, this is Gateway 101 where we place emphasis on prevention and health awareness. We teach you some simple home remedy to help alleviate illnesses. Okay, for we believe strongly that prevention is better than cure. And in Gateway 101, we also create healthcare awareness. We teach you awareness, simple home remedies, things that you need to put in place to prevent illnesses. That is our goal and that's our mission. So community-oriented health awareness. We hold programs around the community teaching people on how to better care for themselves, because for prevention again is better than cure. So in today's broadcast, we're going to be talking about arthritis, because arthritis is a general term for condition that causes pain. So we'll go details on how to better manage it. We're also going to talk about the various type of arthritis. Okay? So without wasting much time, thank you for tuning in again. And this is Gateway 101, broadcasted live from Atlanta, Georgia. So arthritis is a general term for condition that causes pain. Okay, it causes pain, it causes stiffness, swelling, and reduced movement in the joints. Okay, there are 100 plus types of arthritis, but they are all involve inflammation or degeneration of joints. So common type of arthritis. The common type will be osteoarthritis. Osteoarthritis is the most common type. Okay, it caused by wear and tears of joint cartilage. So we are saying that in osteoarthritis, which is the most common type of arthritis, it is caused by wear and tears of joint cartilage. Okay, often affected knees, hip, and hands. Another type of arthritis again is rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease where the immune system attacks the joints. Okay, in rheumatoid arthritis, which is common with other people, is an autoimmune disease where the immune system attacks the joints. Mostly in other people, you see that have arthritis, it attacks other people mostly in their hands. You know, they can hardly carry out activities of daily living. Okay, psoriatic arthritis, it is associated with psoriatics. Then gout is another type of arthritis. Gout is caused by uric acid crystal buildup. It often attacks the big toes. Okay, so in gout, it's caused by a uric acid crystal that is built up, often in the big toe. It can be really painful. So, okay, so also have a chelosis. Achinosis is another type of arthritis that attacks the spine. You see people, they kind of bend their back, bend and twisted to the side, because it attacks the spine. And what are the common symptoms of this arthritis? They all have common symptoms. So one of the common symptoms will be joint pain or aching. Joint pain and aching is a common symptom of arthritis. People can be in severe pain. Okay. Then another common symptom again would be stiffness, often worsen in the morning or after rest. So that one would say if your stiffness lasts longer than 30 minutes, you should consult your medical provider. Worsens in the morning, mostly when you try to get up from bed. Okay. Swelling or tenderness is another common symptoms of arthritis. Sometimes the joint is swollen, tender to touch, and can be very painful. Okay. Another common symptom of arthritis will be reduced range of motion. You can barely, because of the stiffness, you can barely do range of motion. You can barely do exercises because it reduces range of motion. Another common symptom again will be warm or redness around the joint. Another common symptom of arthritis will be warm and redness around the joint. Remember that the common symptom of arthritis is joint pain and aching or aching. Okay, so around the joint sometimes will be warm to touch. You see redness, look as if it's a bruise around the joint area and very painful. Okay, so what help manage arthritis? What help manage arthritis? Medical treatment. Medical treatment will be usually, if you go to your provider, they will prescribe pain reliever, something like Tylenol or ibuprofen for you. This medication, they are also over the counter. But in Gateway 101, we always encourage you to use some home remedies, okay, in treating and managing arthritis. We encourage you to use some home remedies. But if the pain becomes so severe, we strongly encourage you to see your medical provider. Pain relievers like Tylenol, acetaminophen, or anti-inflammatory drug like ibuprofen or naproxen. And they also help in managing pain. Okay. Disease modifying drugs, mostly for rheumatoid arthritis. Okay. Then steroid injections for severe joint inflammation. Sometimes your medical provider will give you an injection. Okay. Call it steroid injection. They give you some injection for severe pain, where the pain become unbearable. Sometimes you will be given an injection. Biologic medication for inflammatory arthritis. So if your medication, we strongly encourage you to follow your healthcare provider advice, especially for a long-term medical use. Okay, so we're talking about how to manage arthritis, physical activity and therapy. So we encourage you to get involved in low-impact exercise such as walking, swimming, cycling, strength training to support the joint. Okay, so we encourage you to participate in low impact exercise such as walking, swimming, a little bit of dancing, and cycling. Strength training to support your joint because most pains happen in the joint area. Stretching to maintain flexibility. Don't forget, in arthritis, sometimes the joint becomes so stiff that you can hardly do range of motion. So stretching, you do that to maintain flexibility. Okay. Physical therapy for joint specific plan. Sometimes your medical provider might put you on a physical therapy. Okay. For a joint specific plan. Regular movement actually reduces pain and stiffness over time. Low impact exercise would help reduce pain and stiffness over time. Weight management. Weight management reduces excess weight, lower stress on joint. Reducing excess weight, lower stress on joint. Obesity is a contributing factor to arthritis, and reducing weight by 5 to 10% will have a great impact on your joint. This will greatly reduce your joint pain because excess weight puts stress on your joint, especially your knees, hip, and spine. Okay, so still on arthritis management. So we say you can use cold and heat therapy to better manage arthritis. Okay, heat help relax muscles and ease stiffness. Cold reduces swelling and numbs pain. Okay, lifestyle and home strategies. Let's talk about lifestyle and home strategies for arthritis. Use assistive device like brace, cane, or walker. Okay, to ambulate if you're having difficulty walking around or to support you. Okay, practice joint protection. Avoid repetitive strain. Practice joint protection. So avoid repetitive strain. This will help manage arthritis pain. Ensure good sleep and manage stress. We cannot overemphasize sleep. At least have 7 to 9 hours of sleep. Very important. And manage stress also. Okay, because poor sleep results to stress, and stress result to pain. Maintain good posture, maintain good body posture. Very, very important. Okay. Nutrient and diet. Nutrition and diet. Anti-inflammatory food. Food that can worsen arthritis should be avoided. So engage in anti-inflammatory food, such as fatty fish like omega-3, fruits and vegetables, whole grains, olive oil. Olive oil helps lubricate the joints. It's very essential for the management of arthritis. Limit processed food. We always encourage you to look at the can label anytime you go to your grocery store. So limit sugar and excessive alcohol. So some people benefit from vitamin D, calcium, or turmeric supplement. The supplement should be discussed with your medical provider. Still on arthritis management. When is surgery considered? When do you consider surgery in arthritis? Joint replacement or hip replacement or repair may be an option if pain and disability are severe and other treatment fail. So surgery is the last resort. Management of arthritis. Surgery is the last resort. Joint replacement or repair may be an option if pain and disability are severe and other treatment fail. So surgery is the last option in arthritis management. So when to see a doctor? Persistent joint pain or swelling, go and see your doctor. So we are saying that if you have a persistent joint pain or swelling, go and see your medical provider. And also, morning stiffness lasting more than 30 to 60 minutes, go and see your provider. Go and see your provider. If you have a morning stiffness lasting more than 30 to 60 minutes, go and see a provider. Okay? Joint readiness, warm to touch, or unexplained fatigue, go and see your doctor. Go and see your doctor. This is a medical emergency that you don't want to waste time in seeking medical help. Okay? Healthy habit. Get enough sleep. Manage stress. Stress can worsen inflammation. Avoid smoking cigarette. Vaping increases arthritis severity. Don't smoke cigarette. You have arthritis because it increases arthritis severity. Okay? Physical and supportive therapy. Physical therapy will improve strength and mobility. Occupational therapy helps with daily tasks, mostly activity of daily living. And like people with rheumatoid arthritis will say that this occurs from the age of 30 and above, and it is affected other people. So those suffering from rheumatoid arthritis, they can hardly do activities of daily living. These people may likely need occupational therapy. Okay, they have to be teach occupational therapy. Very important. Okay. Mind-body techniques. Mind-body techniques. This will be meditation, deep breathing. Okay, it help pain with coping. We also said that you should limit inflammatory foods such as excess sugar, processed food, saturated fat. Stay hydrated. Stay hydrated, very important. If you want to manage arthritis, stay hydrated. Very important. Okay, so let's recap. Let's see what we have gone through so far. Let's recap for the benefit of those just joining. We are talking about what is arthritis and how can it be managed. I will say that arthritis is a general term for condition that causes pain, stiffness, swelling, and reduced movement in the joint. That's arthritis. Repeat again. Arthritis is a general term for conditions that causes pain, stiffness, swelling, and reduced movement in the joint. I would say that there are 100 type of arthritis or more, but they are all involved in inflammation or degeneration of a joint. Okay? I would say that we're going to be treating the common type of arthritis. I would say that the common type of arthritis will be, the most common one will be osteoarthritis. Osteoarthritis is the most common type. It's caused by wear and tears of joint cartilage, often affected knee, hip, hands. We also talk about rheumatoid arthritis, RA. It's an autoimmune disease where the immune system attacks the joint. Sporadic arthritis associated with sporosis. Gout is another cause, again, by uric acid crystal buildup in the joint, often in the big toe. Gout can be very painful. Sometimes they put them in allopurinol. That's the common medication for it. Allopurinol 100 milligrams or so to help treat it. But you also need to be hydrated. You need a lot of fluid if you have gout too. Okay, dehydration will worsen the pain. Okay, I will talk about the common symptoms of arthritis. I would say joint pain and aching. Joint pain and aching is a common symptom of arthritis. Stiffness, awful worsening in the morning or after rest. It's also a common symptom of arthritis. Swelling or tenderness, most around the joint area. Common symptom of arthritis. Reduced range of motion. Because of the stiffness, you can barely move your joint. So arthritis reduces range of motion. It's a common symptom of arthritis. Warmth or redness around the joint area. So that comes from arthritis. We also talk about what helps manage arthritis. I would say medical treatment like pain reliever, something like Tylenol, acetaminophen, or anti-inflammatory drug like ibuprofen, naproxen. They all help in management of arthritis pain. Disease-modifying drug for rheumatoid arthritis and autoimmune types. Steroid injection. Sometimes your medical provider will have to give you injection for severe joint inflammation. And prescribe injection for you. Biologic medication for inflammatory arthritis. Biologic medication. Sometimes a medical provider will recommend that for inflammatory arthritis. So the bottom line is always follow your healthcare provider advice, especially for long-term medication use. Okay? So we also talk about physical activity and therapy. I would say that low-impact exercise, mostly walking, swimming, cycling, okay, will lower your pain. Stretching training to support your joint. We'll say that's also stretching to maintain flexibility, because most of the symptoms of arthritis is joint stiffness. So regular stretching will help maintain flexibility. Okay. Physical therapy for joint-specific plan. So the medical provider might put you on physical therapy for a specific plan. Okay? Regular movement actually reduce pain and stiffness over time. So we strongly encourage you to engage in 30 minutes a day exercise, low impact exercise, such as moving around, cycling, and swimming. Those are simple or low impact exercise. So regular movement actually reduce pain and stiffness over time. Okay? We'll also talk about weight management. Remember, we're talking about ways to help manage arthritis. I was saying that weight management is another way of help managing arthritis. So reducing excess weight will lower stress on your joint because weight puts strain on your joint. So just losing 5 to 10% of weight will have a great impact relieving your arthritis. Okay, so we strongly encourage you to engage in weight management. That obesity is one of the contributing factors to arthritis. You can also use heat and cold therapy to manage pain. Okay, heat therapy will relax muscles and ease stiffness, while cold therapy reduces swelling and numb the pain. Yeah. So lifestyle and home strategy. And we're about to use assistive devices such as brace, cane, walker, okay, to help you stabilize when walking around, if your case is that severe. Okay, so also encourage you to practice joint protection, avoid repetitive strain on your joint if you have arthritis. Okay. Ensure good sleep and manage stress. Very important if you're having arthritis, because poor sleep will contribute to stress, and stress have a great impact on arthritis. So ensure good sleep and manage stress. Always maintain a good posture, okay? Especially when you are lifting. Diet and nutrition. We will encourage you to engage in anti-inflammatory food, fatty fish, omega-3, fruit and vegetable, whole grain, olive oil. We also encourage you to limit processed foods, sugars, and excessive alcohol. Should be limited if you're having arthritis. Okay? Excessive alcohol will worsen your arthritis situation, mostly those having gout. Then some people benefit from vitamin D supplement, calcium, or turmeric, but supplements should be discussed with your medical provider. Don't just go over the counter and buy things and don't buy supplements. Okay, you got to discuss that with your healthcare provider. Very essential. Okay, because a blood work needs to be done before your healthcare provider will prescribe or put you on supplement. Very important. When is surgery considered? We said that surgery is the last option in arthritis management. Okay? Surgery is the last option. So joint replacement or repair may be an option if pain and disability are severe and other treatment fails. Last option. surgery. Surgical treatment is the last option in arthritis management. So if other treatment options fail, your medical provider might resort to surgery, such as joint replacement or repair. When to see a doctor? You should seek a medical advice immediately if persistent joint pain or swelling. You have persistent pain that will not go away. You're taking prescribed medication, the pain is still there. You have swelling. You need to seek medical help immediately. Okay? Morning stiffness lasting more than 30 to 60 minutes. Go and see your medical doctor. If you have a morning stiffness that is lasting more than 30 to 60 seconds, you need to seek medical treatment ASAP. Or you have joint redness, warmth, or unexplained fatigue, you need to seek medical treatment immediately. Okay? Sudden severe joint pain, especially in one joint, you need to see medical treatment immediately. Another better way again of managing arthritis is healthy habit, such as avoid smoking, because smoking increasing arthritis severity. Okay, you can also be involved in physical and supportive therapy, such as physical therapy. Physical therapy improves strength and mobility. Okay, occupational therapy help with daily tasks, such activities of daily living, and this is common with people who are having rheumatoid arthritis. Older people who can no longer use their hands because their hands are stiff and numbed with severe pain. They can barely lift anything. So such people will be engaged in occupational therapy again. You got to teach them how to do the simple tasks, activities of daily living to help them go by. Don't forget, rheumatoid arthritis attack older people more. Okay, so they will need some kind of occupational therapy for be able to perform tasks, basic tasks again. Okay, I would say stay hydrated. You need to drink a lot of fluid, a lot of water, to be precise. Okay, drink a lot of water. Avoid sugary fluid. Sugary food should be avoided. So drink a lot of water. That cannot be overemphasized. Okay? I would say stay away from excess sugar, processed food, and saturated fat. So that is our recap for what we have done so far for today. But let's look at arthritis overview. Okay, let's look at arthritis overview. I will say that, remember, we said that arthritis is a general term for a condition that causes inflammation, pain, and stiffness in the joint. A joint is where two bones meet, like the nail, the hip, your fingers. Arthritis can affect people of all ages, young, old, although it's more common as people get older. That's a fact. So what happened in arthritis? What happened in arthritis? I will say that when you have arthritis, the tissue in or around a joint become damaged. Take that again. When you have arthritis, the tissue in or around a joint become damaged or inflamed. This can lead to pain during movement or even at rest. Okay? Swelling or tenderness. This can lead to swelling and tenderness. This can also lead to stiffness, especially in the morning or after resting. Okay? This will reduce range of motion because of the stiffness. You can barely do range of motion. But your hand, the joint will be so rigid or stiff. The joint will be so stiff, you can barely move it around. So arthritis will cause reduced range of motion. And if not properly managed, over time, if arthritis is not properly managed in over time, joint deformity can occur over time. Joint deformity can occur over time in some type of arthritis. Remember, I will say that there are more than 100 types of arthritis, but the most common one will be the osteoarthritis. Osteoarthritis is the most common type. This is caused by wear and tear of joint cartilage. It is caused by wear and tears of joint cartilage. It's also common in your knees area, your hip, your hand, and your spine. It's most frequent with aging, obesity, or previous joint injury. Okay? If you have a joint injury before, you are at risk for arthritis, for osteoarthritis. Rheumatoid arthritis, what happened? It's an autoimmune disease where the immune system attacks the joint. It often affects both sides of the body equally. Okay? It can cause fatigue and affect other organs of the body. It usually starts between the age of 30 to 60. Okay? Gout, G-O-U-T, gout. Gout caused by buildup of uric acid crystal in the joint. Pain can be so severe, especially in your big toe. You see people with gout, they go through a lot of pain, and they normally prescribe allopurinol 100 milligrams once a day or twice a day, depends on the severity of the pain. So make sure you see your medical provider if you're having gout. This is caused by a build-up of uric acid crystal in the joint. Often affect the big toe. Okay? Sudden severe pain and swelling, that is gout. Gout pain can be sudden and it can be severe, sometimes swollen. Sporadic arthritis occurs with people with sporosis, can affect joint, skin, and nails. How arthritis affect people? Arthritis can affect daily life in many ways, such as physical effect. How can arthritis affect physical effect of people? It will affect physical effect of people by difficulty walking, climbing stairs, or using hands. Arthritis will also cause trouble with daily tasks like dressing or cooking. Simple activities of daily living. Arthritis can be, when arthritis is severe, it can cause trouble with tasks like dressing or cooking. Chronic pain and fatigue is another physical effect of arthritis. Emotional and mental effect is stress, anxiety, or depression due to long-term pain. If you have been in pain for so long, you will be stressed. This will cause you emotional and mental effect. Okay, sleep problem. You can barely sleep if you're in severe pain. So that will also cause you emotional and mental health effect. Okay, so work and lifestyle impact of arthritis patient. So we said reduce ability to walk or exercise. You cannot do much of exercise if you're in severe pain. So it affects your ability to walk or exercise because of the pain. It may also limit independency if severe. So who is at risk for arthritis? I would say that older adults, they are greatly at risk for arthritis. Older adults are greatly at risk for arthritis. Okay? People with a family history of arthritis with genetics. Great grandfather has arthritis, grandfather has arthritis, current patient has arthritis, so you are at risk because it runs in your family lineage. Okay? Those who are overweight, they are at risk for arthritis. Obesity is a contributing factor to arthritis. It's a major contributing factor to arthritis. So those who are overweight, they are at risk for arthritis. Past joint injury, they are at risk for arthritis. People with past joint injuries are at risk for arthritis. Certain occupation or repetitive movement, occupation sort of construction worker who carry a lot of load and do a lot of tremendous job, a lot of physical job, they are at risk for arthritis. Okay? Can arthritis be managed? The answer is yes. Why many types of arthritis cannot be cured? Symptoms can often be well managed. I'll take that again. Why many types of arthritis cannot be cured, but symptoms can often be well managed. With regular, gentle exercise, health and weight management, we'll talk about that before. Medications such as pain reliever or anti-inflammatory drugs such as ibuprofen, physical therapy, balanced diet and lifestyle changes. This way can be used to manage arthritis. Okay? So let's recap again. Remember, we were talking about what is arthritis and how does it affect people. So we're going to recap again one more time for benefit of those who are just joining us. Okay? I would say that arthritis is a general term for condition that causes inflammation, pain, and stiffness in the joint. A joint is where two bones meet, like the knee, hip, or finger. Arthritis can affect people of all ages, although it is more common as people get older. Okay, I will talk about what is arthritis. I will say that when you have arthritis, the tissue in or around the joint become damaged or inflamed. This can lead to pain during movement or even at rest, swelling and tenderness, stiffness, especially in the morning or after resting, reduced range of motion, joint deformity over time is a type of arthritis. Okay? And common type of arthritis, we said there are over 100 type of arthritis, but the most common one are osteoarthritis. I would say that osteoarthritis is the most common type because this is caused by wear and tears of joint cartilage. And it's also common in your knee area, your hip, your back, and your spine. Waist pain, severe waist pain, osteoarthritis. It is most frequent with aging, obesity, or previous joint injury. We also talk about rheumatoid arthritis. I would say that it is an autoimmune disease. The immune system attacks the joint. Pain can be severe, often affect both sides of the body equally. Okay? Can cause fatigue and affect other organs. Usually started age 30 to 60. Gout, we said that gout caused by buildup of uric acid crystal in the joint. It is a buildup of uric acid crystal in the joint. Pain can be so severe and often affect the big toe. I would say that see your medical doctor so that he can prescribe some medication for you, but we do have a home remedy also for arthritis. So check that out in Gateway 101. Sporadic arthritis occurs with people with cirrhosis. Can affect joint, skin, and nails. How arthritis affect people? We said that arthritis can affect daily life in many ways, such as physical effect. We'll talk about physical effects. We'll talk about difficulty walking, climbing stairs, or using your hand. If you have arthritis, when it becomes chronic and severe, some people can't even walk their steps because of the joint pain. Okay, they can't engage in any kind of activity at all. They will be in severe pain. So people might be having trouble with daily tasks like dressing or cooking. Chronic pain and fatigue. Those are physical effects of arthritis. Emotional and mental health effects, stress, anxiety, or depression due to long-term pain. Yeah. People go through a lot of emotional and mental effect if they are in severe pain that persists for a long time or perpetual pain. They go through a lot of emotional distress. Okay? And if you're in pain, you can barely sleep, so you will have a poor sleep. And if you don't sleep properly, you will be stressed out, and stress will worsen arthritis. Work and lifestyle impact. Arthritis reduces ability to walk or exercise properly. But you are in severe pain. You can't do much when you are in severe pain. May limit independence if severe. Who is at risk for arthritis? Who is at risk? I would say that older people, they are at risk for arthritis. People with a family history of arthritis, they are at risk for arthritis. Your great-grandfather have it, your grandfather have it, your parents have it. So it runs in your lineage. So you are at risk for arthritis. People who are overweight, obesity is a major contributing factor to arthritis. So if you're overweight, losing weight of 5 to 10% will greatly reduce your arthritis pain. So those who are overweight, they are at risk. Past joint injury, yeah, mostly in the joint area. fractures in the joint area, you are at a very great risk for arthritis as you age. Steady occupation, repetitive movement. I would say that like construction worker who carry a lot of heavy stuff, they are engaged in a lot of physical activity, physical occupation. Now, steady occupation or repetitive movement can actually cause arthritis. You will be at risk for arthritis. Can arthritis be managed? The answer is yes. But the truth is, why many types of arthritis cannot be cured. Symptoms can often be managed with regular, gentle exercise. Many types of arthritis cannot be cured, but regular, gentle exercise, weight management, healthy eating, medication such as pain reliever or anti-inflammatory drugs such as ibuprofen can also be used to manage arthritis pain. I will say that it depends on the severity of the pain. Physical therapy can also be recommended to help manage arthritis pain. Yeah, balanced diet and lifestyle change. Stop smoking and drinking excessive alcohol. Stop all that. Okay, I will say that drinking of alcohol will cause you a lot of pain. It will worsen you will be at risk for arthritis if you are drinking alcohol. You will be at risk for arthritis. Okay, so let's talk about some prevention tips for arthritis. Prevention tips for arthritis. Okay, remember, we said that arthritis is a condition that causes joint pain. Okay, it causes stiffness and it also causes swelling and it reduces movement. I will say that while some type of arthritis cannot be fully prevented, healthy lifestyle choices can greatly reduce the risk, lower slow progression of arthritis, and ease symptoms. Take notice of that. Ease symptoms. Okay, it is symptoms. Very important. Arthritis prevention tips. So let me give you some tips to help arthritis prevention. Remember, in Gateway 101, we places much emphasis on prevention because we strongly believe that prevention is better than cure. So it teaches you how to prevent some certain things that you will put in place to help prevent illnesses or to help ease pain or alleviate pain. Okay, so maintaining a healthy weight, talk about that before, it's repeating again, will help prevent arthritis. Okay, extra weight puts strength on joint, especially knees, hip, and spine. So if you don't want to have arthritis, maintain your weight, manage your weight properly, because extra weight puts stress on joint, especially knees, hip, and spine. Okay, losing even a small amount of weight reduces joint pressure. Yeah, 5 to 10% of weight loss will reduce joint pressure. Stay physically active if you don't want to have arthritis. So regular movement keeps joint flexible and strong. prevent stiffness and muscle weaknesses. Okay, we're still talking about arthritis prevention tips. I will say regular movement, keep joint flexible and strong, and also prevent stiffness and muscle weaknesses. So protect your joint. Avoid repetitive strain and poor posture. Talking about arthritis preventive tips. Okay? I'll say that regular movement keeps joint flexible and strong. I will say prevent stiffnesses and muscle weaknesses. Stay physically active will prevent stiffnesses and muscle weakness. Okay? Protect your joint. These are arthritis preventive tips. Said you should protect your joint. Avoid repetitive strain and poor posture. Use proper lifting and techniques. Okay, most people who have severe back pain today, severe back pain, waist pain, they were not doing proper lifting techniques. Never lift with your back. Okay? That will maintain a good body posture. Take break during long physical activity. So this will help you. Don't overwork yourself. Okay? Prevent joint injury. Wear supportive shoes. Use protective gear during sport or heavy work. Okay? Treat injury promptly to prevent long-term damage. Injury should be treated promptly to prevent long-term damages. Okay? Manage chronic condition. So if you're having diabetics, high blood pressure, high cholesterol, bad cholesterol, those should be properly managed. If you don't want to have arthritis, these are preventive tips. Quit smoking. Smoking increases inflammation and joint damage. And I take that again. Quit smoking. Arthritis prevention tip. For smoking, increases inflammation and joint damage. Okay? Lifestyle tip to manage or reduce arthritis symptoms. I would say exercise regularly, low impact. Do not engage in acrobatic exercise. Okay, you could exercise regularly, but let it be simple exercise, low impact. Best option with this will include walking, swimming, cycling, yoga, or stretching. Aim for 30 minutes most days of the week. Aim for 30 minutes most days of the week. Okay? Eat an anti-inflammatory diet such as fruits, vegetable, fatty fish, salmon, sardines, nuts and seed, whole grain, olive oil. Olive oil helps lubricate the joint. Very important. We also encourage you to limit your sugary food, fried food, processed food, excess salt. Limit all that. Stay hydrated. Make sure you drink a lot of water because water helps keep cartilage healthy. So drink a lot of water, but not in excess. Water also reduces joint stiffness. Okay, so stay hydrated. Get enough rest. Okay, sleep help the body repair tissue. Sleep help the body repair tissue, so get enough sleep. Balance activity with rest period. Yep, you should balance activities with rest period. Manage stress. Stress worsens inflammation and pain, so you should manage stress. Okay, try deep breathing, meditation, or gentle stretching. Use heat and cold therapy. Heat relaxes stiff joint. Cold reduces swelling and pain. Okay. Consider supplement with doctor approval, such as omega-3 fatty acid, vitamin D, calcium, turmeric. We strongly encourage you not to buy any of these supplements without consulting your healthcare provider. Very important. Blood work needs to be done for you to get on any of these supplements. When to see a doctor, we said that joint pain that persists joint pain or swelling, please go and see a medical provider ASAP. Morning stiffness lasting more than 30 minutes, please go and see your medical provider ASAP. Difficulty moving or performing daily tasks, mostly people with arthritis, people with rheumatoid arthritis, older people, have this degenerated disease. They have to be on occupational therapy to be able to manage the activities of daily living. So if you're having difficulty moving or performing your daily tasks, go and see your medical provider so that he can put you on occupational therapy. Okay? Because early care can prevent joint damage and improve quality of life. Okay, so let us recap again. We said that arthritis is a condition that causes joint pain, stiffness, swelling, and reduced movement. While some type of arthritis can be fully prevented, healthy lifestyle choice can greatly reduce the risk, slow progression, and ease symptoms. Take notice of that, ease symptoms. Okay? So I will say that arthritis, I will also give some arthritis prevention tips. I will say that maintain a healthy weight, because extra weight puts stress on joint, especially knee, hip, and spine. So losing even a small amount of weight reduces joint pressure. Stay physically active. Okay? Regular movement keeps joint flexible and strong. Prevent stiffness and muscle weakness. So protect your joint. Avoid repetitive strain and poor posture. Use proper lifting techniques. Take break during long physical activity. Take break. Okay? Protect your joint injury. Prevent joint injury, Wear supportive shoes. And also use protective jacket during sport or heavy work. We said treat injury promptly to prevent long-term damage. Okay, so manage chronic condition. People with diabetes, high blood pressure, cholesterol should properly manage their chronic condition in order to prevent arthritis. We also said that quit smoking cigarette, vaping, smoking weed and all that stuff, or smoking increases inflammation and joint damage. Okay, so we'll also talk about lifestyle tips to manage or reduce arthritis symptoms. Lifestyle tip to manage or reduce arthritis symptoms. We said best option will include walking, swimming, cycling, yoga, or stretching. This lifestyle tip will help to reduce arthritic symptoms. Okay? Aim for 30 minutes most day of the week, 150 minutes of regular exercises for a week would be ideal. Okay? Eat anti-inflammatory diet such as fruit and veggies, fatty fish such as salmon and sardines, nuts and seeds, whole grain, olive oil. We said that olive oil helps lubricate the joint. I will also encourage you to limit your sugary food, fried food, processed food, excess salt. Okay? We also encourage you to stay hydrated. Water helps keep cartilage healthy, reduce joint stiffness. So get enough rest. Sleep help the body repair tissues. Balance activity with rest, period. Okay? And we also say that manage stress. Stress worsens inflammation and pain. Try deep breathing meditation or gently stretching. Use heat and cold therapy. For heat relaxes stiff joint, while cold therapy reduces swelling and pain. Consider supplement with doctor approval such as omega-3 fatty acid, vitamin D, calcium, turmeric. When to see a physical doctor, when to see your doctor. We say persistent joint pain or swelling. You need a medical advice. Go and see your medical provider ASAP if you have persistent joint pain or swelling. Okay? Morning stiffness lasting more than 30 minutes. You need to see your medical doctor ASAP. Difficulty moving or performing daily tasks. You need to see your medical provider immediately. Okay? So these are some arthritis preventive tips, okay, that you can use to help reduce the symptoms of arthritis. Remember, this does not constitute a cure. Okay? And remember what we said, that we have a home remedy that can help reduce the symptoms. So if you go to Get Well 101 on this channel, you will be able to pull out some of the videos we posted earlier on how to reduce or ease arthritis pain. Okay? In Get Well 101, we'll have a lot of the tips, a lot of preventive measure too is in there. So go ahead and watch some of these videos. Okay? It is all free. You don't have to pay to watch these videos. And this will save you time and money. Do not forget, that in Gateway 101 will teaches you preventive measures, for prevention is better than cure. So keep on watching. This is Gateway 101. Thank you for watching, and bye for now. Till I come your way again, this is Gateway 101. Thank you.